Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest is Dr. Robert Vogel. He's worked as a clinical professor of medicine at the University of Colorado, Denver, spent 14 years as director of cardiology at the University of Maryland, and was past president of the Association of University Cardiologists. Now, in addition, Dr. Vogel pioneered tomographic myocardial perfusion imaging, discovered acute vascular effects of food, physical activity, and media, and is also the author of more than 250 publications and co-author of the Pritikin Edge. It's a dietary consultant to the NIH and works as a preventive cardiology consultant to the NFL. Welcome to the program today, Bob.
Nice to be with you, Neal.
Talk a little bit about the Pritikin Edge. What was your audience? What's the book about? And
we as Americans really don't live a very healthy lifestyle. And by that I mean we don't have a very good diet. We don't exercise enough. Too many of us smoke. And in general, we have the ravages of daily stress. Pritikin is a program that has been in existence since 1975. It's a lifestyle program, and it was founded by an individual, not a physician, who was diagnosed with heart disease and simply looked around the world and saw that societies, countries, which had better lifestyles, had far less heart disease, and he started the Pritikin lifestyle program. About 8 years ago, I wrote a book. I'm very interested in healthy lifestyle. I saw that Pritikin had a very good program, and I wrote a book about how to live a healthy lifestyle.
So you're basically advocating this Pritikin intensive cardiac rehabilitation lifestyle, yeah?
Well, the intensive cardiac rehabilitation program is a little bit more recent. It extends the in-house program that Pritikin has and is now applicable to people in hospitals who have had a heart attack or undergone angioplasty or bypass surgery, so that they can get on a better lifestyle program.
Now, it's safe to say that you are an expert in heart health, in treatment of some heart ailments. Let's talk about this silent heart attack. How does it differ from, I guess, the average everyday heart attack that we hear about? We hear about heart attack, massive heart attacks in your sleep. What is a silent heart attack?
Well, it's important for everybody to know the symptoms of a heart attack. And traditionally, or characteristically, heart attack has chest pain or jaw pain or neck pain or left arm pain, and it's kind of crushing in quality, and it comes on generally without doing any unusual physical activity. So it's that when you experience that, it's time to call 911. But 20 to 30% of individuals, a higher percentage in women, really don't have characteristic symptoms. They may feel tired. They may be a little short of breath. They may have what they think is heartburn, or they may have no symptoms at all. And we think of those as silent, and they may be silent because they have no symptoms, or the symptoms are not characteristic, or even the individual experienced symptoms, goes to a doctor, and the doctor doesn't recognize, or the emergency room doesn't recognize them as being caused by heart trouble. And so this is the whole spectrum of silent heart attacks.
When I think of a heart attack, I'm thinking of, you're mowing the lawn, you grab your chest, you keel over, and maybe you make it to the hospital, maybe you don't. This silent heart attack, having little or no symptoms, and you say sometimes doctors don't recognize that this has even happened. Is a person who's never had any type of heart attack at risk, or is a person who's had a heart attack, or maybe a couple, more at risk for this asymptomatic type of heart attack?
Well, it could happen in either case. Certainly, if you've not had a heart attack before or don't know that you have heart trouble, whatever symptoms you're feeling may be confusing and may not be typical. The typical crushing chest pain with radiation down the left arm, shortness of breath, and all the things that are quite characteristic. But even if you do have heart trouble, and I have a number of patients who have both heart trouble and some sort of gastrointestinal trouble, and so they have heartburn and they have heart pain as well, and it's hard for them to distinguish one from another. And so it can, these silent heart attacks may be truly silent, but also they can just be confused with other things. Sometimes, and this is especially true in women, the symptoms are not characteristic, and you just feel tired. You're having an off day, you may be a little short of breath, you have trouble walking upstairs or whatever. And it's nothing more than that. And you may say, well, I'll go see my doctor next week. Well, that has to be recognized as potentially heart trouble as well.
Is lifestyle the contributing factor to silent heart attack, or can you be genetically predisposed to have a silent heart attack, just like someone is genetically predisposed for maybe Alzheimer's or stroke?
Well, Neal, it's not that we're genetically predisposed to have silent heart attacks. We certainly have a genetic predisposition to heart disease in general. About 50% of our risk of having heart trouble comes from our genes. We didn't select our parents as well as we might have. The other 50% comes from what we can correct, and that is lifestyle. It's diet, exercise, smoking cessation, stress reduction, etc. And also knowing that our numbers are right. What's your blood pressure? What is your blood sugar? What is your cholesterol? These are very important facets in preventing heart disease.
In addition to your regular, normal, healthy eating habits in order to prevent heart disease, are there things that we can do differently to prevent silent heart attacks specifically, or does a healthy lifestyle prevent those as well as your traditional heart attacks?
It prevents both. That's the good news. And I might just add at this point that patients with diabetes, and diabetes, of course, is really a lifestyle problem because it comes from overeating and obesity and lack of exercise. Diabetics have more frequent silent heart trouble and silent heart attacks. In addition, women, as mentioned, also have more silent heart attacks. But that can be prevented with lifestyle as well as the traditional painful heart attacks prevented with a better lifestyle.
Should someone realize that they're experiencing a heart attack, or someone that they're with recognize that they're experiencing something, like a silent heart attack, what is the most important treatment to begin with in a silent heart attack?
Call 911. The big mistake that people make, whether it's a silent or a very typical heart attack, is they call their doctor, or they say, I'll drive myself into the emergency room, or whatever. You have to call 911. The risk of something catastrophic happening is highest very early after a heart attack starts. So you can pass out, and you don't want to be driving a car and pass out. So call 911 is the critical thing, and do it quickly because time is muscle. We now open up arteries with a stent, and that really prevents a lot of the damage that traditionally had been done before we were able to do these procedures. So call 911 and do it promptly.
Right. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio talking today with Dr. Robert Vogel, cardiologist and co-author of the Pritikin Edge. It's been a pleasure having you in studio today with us, Bob.
Very nice to talk with you, Neal.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.